How do fusion genes impact leukemia prognosis? Imagine a tiny change in your genetic code that can influence how a disease behaves. That's what fusion genes are. They happen when parts of two different genes join together because of chromosomal rearrangements. In leukemia, these fusion genes are more than just markers. They shape how doctors understand the disease and plan treatment. They help classify leukemia into different subtypes, each with its own outlook. For example, some fusion genes are linked to better outcomes, while others suggest a more aggressive disease. In acute myeloid leukemia and other myeloid cancers, fusion genes are found in about 30% of cases. Identifying these genes is key for diagnosis and prognosis. Certain fusion genes, like the BCR-ABL1 fusion, are associated with specific leukemia types and can guide targeted therapies. For instance, drugs called tyrosine kinase inhibitors are effective against leukemias with the BCR-ABL1 fusion gene. On the other hand, some fusion genes, such as the SETCAN or NUP214 fusion, tend to be linked with poorer outcomes, including higher chances of relapse and lower survival rates. Monitoring the presence and levels of fusion genes helps doctors predict how the disease might progress. Using sensitive techniques like real-time quantitative PCR, they can measure the amount of fusion gene transcripts in the blood or bone marrow. This helps detect minimal residual disease, which is tiny amounts of leukemia cells that might cause a relapse. Early detection of residual disease allows for timely adjustments in treatment, potentially improving the patient's outlook. Fusion genes also play a role in risk stratification. They help categorize patients into favorable, intermediate, or adverse risk groups based on their genetic profile. This classification influences how aggressive the treatment should be. For example, patients with fusion genes associated with favorable prognosis might receive less intensive therapy, while those with adverse fusion genes might need more aggressive approaches. Furthermore, combining fusion gene information with other genetic mutations and clinical factors creates more accurate prognostic models. This personalized approach helps tailor treatments to each patient's unique genetic makeup, increasing the chances of success. Advances in RNA sequencing and next-generation sequencing have improved our ability to detect and understand fusion genes, leading to better diagnostic precision and more refined risk assessments. In summary, fusion genes are vital in shaping leukemia prognosis. They help define the disease subtype, guide targeted therapies, and enable sensitive monitoring of disease status. Detecting and measuring these genes is now a cornerstone of modern leukemia management, helping doctors predict outcomes and personalize treatments to improve survival and quality of life. Always remember, individual cases vary, so it's essential to consult healthcare professionals for personalized advice.